So in our last video we discussed about hypovolemic shock. So there I told that there are 4 classes of hypovolemic shock. Class 1 where there is 0 to 15% blood loss, and if we here all the parameters are normal. In class 2 15 to 30% blood loss. Here there is compensation by increased pulse rate, but systolic blood pressure remains normal. Phase deficit is -2 to -6. Management is with IV crystalloids. In class 3 it is with 30 to 40% blood loss. Most important, systolic blood pressure increased, right? And -6 to -10 base deficit, patient remain confused. Management with crystalloids and colloids 3:1. And in class 4 more than 40% blood loss, where there is parameters becomes non-recordable, and management with massive blood transfusion. Now we will continue with the massive blood transfusion, right? One second. Yes. So there you can see the slide of massive blood transfusion complications, right? So before we go to complications, we have to understand few things about massive blood transfusion. So we will discuss about massive blood transfusion, right? So the definition of massive blood transfusion comes under 3 major headings, right? We can say that if we replace entire blood volume in 24 hours, this is massive blood transfusion. Or more than 10 units in 24 hours, this is also massive blood transfusion. Or more than 4 units in 1 hour, this is also massive blood transfusion. So basically we can say there are 3 definitions anyone may be asked. If we replace entire blood volume in 24 hours, or more than 10 units in 24 hours, or more than 4 units in 1 hour, these all are definitions of massive blood transfusion. But what is most important for you is and what has been tested already twice, right, is your complications of massive blood transfusion. Very important topic, right? So just remember, I will write the complications, and also I will tell how you will remember the complications, right? So first complication is hypothermia. See, everything will find hypo except hyperkalemia. Now here I will like to tell one point, that actually it is hyperkalemia followed by hypokalemia, but they confuse us by giving options of like hypokalemia. Remember, both hyperkalemia and hypokalemia is seen. Everything is hypo in complication, only hyperkalemia is there, right? So first we saw there is hypothermia, then hyperkalemia followed by hypokalemia, then there is hypocalcemia. Just now I mentioned everything is hypo, right? So then fourth is metabolic alkalosis. Why? Due to excess citrate, right? And there is coagulopathy. Coagulopathy is the most common cause of death, right? To prevent coagulopathy, we can use PRBC is to FFP is to platelet in the ratio 1:1:1, right? So remember this point. So we will revise the complications: hypothermia, hyperkalemia followed by hypokalemia, hypocalcemia, metabolic alkalosis, coagulopathy. And to prevent coagulopathy we can use PRBC is to FFP is to platelet 1:1:1. PRBC is packed RBC, right? So now we will see 2 important terms: TRELI and TECO. So TRELI, I will just for completion's sake I will discuss it briefly in my later videos. Just for completion's sake, TRELI is transfusion related acute lung injury, right? Transfusion related acute lung injury, and it is mainly due to HLA antigen, right? This is about your TRALI. Talking about TECO. Now, TECO is your transfusion associated cardiac overload, right? Transfusion associated cardiac overload. There is transfusion patient will complain here. See, the complaints are very important. The transfusion patient will complain of breathlessness and pedal edema. Here management is Lasix, right? So we will revise all the important points once again. First of all, we discussed about hypovolemic shock, and then we came here in massive blood transfusion. So it is a replacement of entire blood volume in 24 hours, or more than 10 units in 24 hours, or more than 4 units in 1 hour. Complications are hypothermia, hyperkalemia, for hypokalemia, hypocalcemia, metabolic alkalosis, coagulopathy. To prevent coagulopathy, we will use packed RBC is to have P is to platelet in the ratio 1:1:1. Talking about TRALI, I mentioned that TRALI is transfusion related acute lung injury. The main cause being the HLA antigen. Talking about TECO, I mentioned that it is a transfusion associated cardiac overload, where the complaints of the patient remains breathlessness and pedal edema, and the management is with Lasix, right? Now we will go back to the slide. Here we can see the complications, and this will be easy for you now, because now you can relate it, right? Hypothermia leading to acidosis, hyperkalemia is there, hypokalemia is also there. They have not mentioned. I would like to mention here that hypokalemia is also there. Everything is hyper is only one thing, hyperkalemia, right? Cytotoxicity, of course, it is there. Hypocalcemia is there, correct? And depletion of platelets and coagulation factors, that is coagulopathy, and fluid overload leading to ARDS, right? Acute respiratory syndrome. Every point is important, and the rest things we have discussed, right? So I hope this video is useful for you, and we will meet in another video, right? Thank you.